What happens if you leave diabetic retinopathy untreated? This is Dr. Anina Abraham from Advanced Retina Care, Hyderabad. This is a patient who came with very advanced diabetic retinopathy. What you can see in the green area is areas of neovascularization. That means new fragile blood vessels have started growing on the outer portion of the retina. What is interesting is in this patient, the central portion of the retina called the macula is absolutely fine. And that's the reason why his vision is absolutely normal. Now, this patient has come just for screening of diabetic retinopathy to see if he has diabetic retinopathy or not. And he ended up having very advanced diabetic retinopathy. Now, if this patient is not treated at this stage, it goes into the next stage. Now, in this stage, those areas which were new blood vessels have started breaking and bleeding, and this is called a vitreous hemorrhage. There is a bleed on the retina and in the vitreous cavity, and by now this bleed causes blurred vision. By now the patient knows that yes, there is a problem with his eye. Why wait for this stage? It is always better to get treated at the earlier stage. Now, if this is also not treated, now the treatment at this stage is very simple. You only give injections, anti-VEGF injections, which help reduce the bleeders. The bleeding also comes down, and you do laser treatment, which is extremely important in this stage of diabetic retinopathy. If this stage is also not treated, and if it's neglected, it goes into the next stage. Let us see what happens there. As you can see here, there's a whitish yellowish membrane all over the retina. Now, what has happened here is a thick membrane forms, and this actually pulls off the retina. If you can see, this whole area is actually a thick fibrovascular membrane which is pulling up the retina, and there is total retinal detachment here. We call it a tractional retinal detachment. And by now the patient is completely blind. At this stage, he needs surgery, and the amount of vision which can be restored depends upon the health of the retina which has been detached from its place. It depends upon complications which can happen during surgery. It is very common to have bleeds which go under the retina. It's very common to have a completely ischemic retina underneath. The optic nerve can become completely pale. There are so many issues which can happen at this stage. So basically, why wait for this stage of diabetic retinopathy? It is always better to get treated at an early stage.